Hi, I'm Karen Perro. I'm one of the technologists here at Faulkner Breast MRI, and what I'm going to be doing is I'm going to be explaining to you how we do a breast MRI. This is Maura. She's our patient. What we have is we actually have some papers here that we're going to be going over. We have to ask the patient these questions to make sure that they're able to go into the magnet to have their breast MRI. And I'm asking her questions such as, is there any chance that you are pregnant?
No.
Do you have any metal in your body?
No.
A pacemaker? Brain aneurysm clip?
No.
Have you ever had any surgery on your breast?
No, I haven't.
Okay, so what I'm going to do at this point is I'm actually going to put an IV in your arm. So what I'm looking for now is I'm actually looking for a vein so that I can place the IV. We look at the antecubital. We look to see if she has a good vein there. If not, we come down to the hand and we look for the hand. So I'm going to put the tourniquet on. So now that the IV is in, we're actually going to go into the room and we're going to set her up into position. So what we've done now is we've actually brought the patient into the room and we've set her up onto the table. We've given her some earplugs to protect her hearing as well as some earphones. We've actually put her into a coil where her breasts are actually hanging down. We do leave the gown on so that it will actually help with the motion of the breast. We've hooked the patient up to an IV because what we'll be doing is we'll be taking some pictures and then we'll be giving her the injection of the contrast material. So now we will slide her into position. This is a nice unit only because the patient does go in feet first and they're able to have their head at the opening at the edge of the magnet. So what we've done now is we have the patient in position and we're actually going to start the shimming process. We go through our auto shim process, then we move on to our center frequency, then we move on to our rodeo verify. If the patient does have implants, either saline or silicone, we'll scan accordingly. And what this does is this actually tunes the patient. We look at the breast tissue, we look to see what it's made of, and the system tunes in specifically to that patient. So we open up our database. So what we do now is we actually enter the patient into the database and we'll start scanning the patient. Last name and then their first name. We actually use their Faulkner ID, female, her date of birth. And then we actually put information as far as why it is that we are doing the patient. We put her weight in, the referring physician, and our initials. Then we actually define the type of scan that we're doing. We're going to run the EDGE protocol. The EDGE protocol is a 0.7 millimeter slice thickness, and we can get 250 slices. They're very sensitive to motion, so it's very important that the patient holds as still as they can. This is our power injector. What's nice about this feature is that it allows us to deliver contrast material over a certain rate in a certain amount of time. For the breast, we actually dose by weight, so we can actually select the type of volume that we want for the contrast. This will give us a rate of 2 cc's per second, dosing 15 cc's, and we're going to follow it by a 2 cc with a 20 cc flush. When we're ready to give the injection, we can arm this, and then we can actually press down here when it comes time for the injection. So what I've tried to do for today is try to give you a little overview of how we image the breast. MRI is actually a wonderful tool that will help us give us another piece of the puzzle to imaging the breast itself.